Let me begin with just an easy softball, everybody knows the answer question. How are the economics of this business going to change in the next 3 years? So let me talk a little bit about the entirety of it. How are the economics changing? What will happen to price and to volume for the key traditional business models, hospital system, the payer, the medical group? And then I think the challenging part is, will the change be gradual, gentle, plannable for, or will it be abrupt? Or in the worst case, will it be abrupt at a time point which we cannot predict? So who is dying to tell us?
I'll start.
Thank you, Dave.
I think the economics of healthcare are varied. If you look at the provider side of the industry, you've got a lot of winners and a lot of losers. Those that are at good economic health seem to be doing well, but there are those at the bottom that are not doing very well, so it's varied. We see on the insurance side that some of the insurers are doing very well. Physicians, generally speaking, in markets I'm aware of, are struggling, particularly in private practice, and I think the model in private practice is becoming untenable, so they're going into group practices. So I see the economics of healthcare as very varied at this time.
I think Dave's exactly right, and I think that's the worst case scenario. I think it's going to be chaotic. It's not going to be a pace of change that's slow or fast. It's going to happen in multiple ways for which you can't prepare, or you have to prepare in many different ways. And the variability is going to be very harmful to hospitals and to other providers.
So, when you speak about that, I have to confess, thinking about this last night, I sometimes wonder whether this will be a kind of a hockey game, not when they're playing the game, but when they stop the game and start fighting with each other, and it's a free-for-all. So great points on the variability, on the unpredictability. Any perspectives on what we should expect to happen to utilization, to pricing, and to variables like that?
The story that I'll tell that may be a bit of an indicator to where the rest of the industry may go. The story stems back to even shortly before I joined Dean, where the organization found itself, the scenario we know all too well now, with a foot in two canoes. The problem being that 50% of our revenues were coming from our owned health plan. And so we were obviously rewarded for value-based care delivery for half of our business. The problem is the other half of our business was rewarded either through fee-for-service Medicare or other fee-for-service payers. And so we were at that point where we needed to decide what we were going to be. The organization stepped into the value world because clearly when we analyzed the economics, even though it was a scary concept, the economics to our business was certainly far greater to focus on value, wellness, prevention, reduction of waste, and reduction of utilization than the prospect of trying to make incremental margins in a volume world.
I was going to speak to just adding some quantification of the work we've done. So over the average, the operating margin for the health services provider segment is 2.5%. That average operating margin has been consistent for the last 5 years. If you look and parse apart the different models and sizes and scales of organizations, two strategies have been proven to be successful in nearly doubling the average expected margin, and that has been true for the last 5 years. One strategy is scale, go bigger. The other strategy has been integration. We've seen a very consistent pattern over a number of years, proving value out of those two strategies, two different paths, equivalent result to the bottom line today.
Great. Jim, Alan, Jim?
Yeah, I wanted to pick up on Craig's comments, and I certainly agree that the way that the business model is evolving is more towards risk and the value perspective versus the volume perspective. But I think when you peel back the layer of the onion, you see that government payers are actively trying to push risk onto health delivery systems, Medicare and Medicaid. I don't think it's quite as clear that trend in the commercial world is as pronounced, and that there are a number of large, sophisticated employers who are going to define contribution approaches and really trying to unleash the consumer purchasing instincts of their employees and dependents. And so, again, not to debate Craig's point, but I don't think it's going to be a clean, subtle move towards risk. I think there's going to continue to be a lot of messiness among large purchasers.
Back to your original question, I'm seeing change at a pace that I've never seen before in my career. One of the signs of that is the merger acquisition activity, and it's not, I don't know if it's any greater than it was, but there are strange bedfellows merging and acquiring today. What I see in health systems as I travel around on behalf of Walgreens is a beginning of a blurring of health systems and health plans in a way I haven't seen before. And it depends on, more so in some ways than the marketplace, the leadership. I know we're going to talk about leadership later, but the leadership of organizations and the willingness to not just take on risk, but take on new roles of population management is really changing the landscape.
Because I think one of the concerns that I have is we don't want to mislead health systems in particular to think that if we very simply continue to focus on unit price, that all will be well, that if we lower the cost per unit, that, you know, even in a competitive world where consumers actually get to decide, per your graph, where the cheapest alternative is, the next wave are the organizations that say, well, all of these units should go away. Is a hospitalization a good thing or a bad thing? And are there bad hospitalizations that actually need to be discontinued or avoided? And so it's not just going to be about the lowest price per hospitalization. It's going to be about a 50% reduction in hospitalizations, a 50% reduction in the use of specialty services in some instances where they can be provided in primary care.
My reaction is we could have been having this panel in 1992 and probably been saying about all the same things.
Uh-oh.
And so the question right now is it going to move quickly? And you need, I think, some major transformational event. Otherwise, it'll move slowly. So the last innovative thing, like out of Medicare from my perspective, was DRGs. And when those came in, think how dramatically the system changed across the country. Right now, everything is local. So I could talk about things we're doing in Iowa and South Dakota that aren't been done anywhere else in the country, transformational, and something else is going on in David's world and something else is going on here, and there's time for lessons learned, but it isn't sustainable.